Hi friends, I'm Dr. Karamat. This is Scientific Doctor channel. Today's video is about gallstones. What are these gallstones? These are stones formed in the gallbladder. Gallbladder is an organ adjacent to the liver where bile is formed and stored and it gets released via the bile duct into the intestine. Bile is essential for the digestion of fats. So how are these gallstones formed? So essentially cholesterol is not soluble in water, but it is soluble in bile. So the cholesterol produced by the liver is dissolved in bile normally. So if there is excess cholesterol produced or the bile flow is slower, the bile gets stagnant, this cholesterol becomes crystallized. These crystals may aggregate to form stones. So this is the reason for gallstones in majority or 80% of the cases. Sometimes rarely there might be another type of stones called pigment stones where there might be calcium and bilirubin deposition in these stones. This is sometimes due to excess production of bilirubin, like where there is destruction of red blood cells, namely in hemolytic anemias. But the common gallstones are due to cholesterol. So these are called cholesterol stones. What are the risk factors for getting gallstones? That is, in whom the risk of getting gallstones is higher. Comparatively, females are at a higher risk when compared to males. And as age advances, the risk of getting gallstones also becomes higher. It is more so in more than 60 years of age, but anybody more than 40 to 45 years of age can get these type of stones. Obesity is an important risk factor. And when you try to reduce your weight, if there is a rapid weight loss, again that is an important risk factor for getting these stones. Family history often plays a role. So if your family members, parents have a history of gallstones, you are at a slightly higher risk compared to a general population. So apart from this, taking hormonal pills, pregnant women, diabetic individuals, so they are also at higher risk of getting gallstones. So having seen the risk factors for gallstones, do all gallstones cause symptoms? Essentially no. In fact, 90% of the people having gallstones may not have any symptoms at all. But in the remaining 10% of the people, they may cause abdominal pain. Especially if they move to the bile duct, they may cause symptoms. They may cause abdominal pain, which can be acute, which can be very severe, which is usually focused to the right side of the abdomen. This pain may travel to the back, to the right shoulder blade. So it can essentially be a severe acute abdominal pain. You can also have nausea or vomiting associated with this pain. Usually with treatment or without treatment, this pain will subside. But in some persons, there is some persistence of pain or recurrence of these symptoms, and you may have certain complications when these gallstones move to the bile duct or to the intestine. They may cause obstruction, thereby causing inflammation of the gallbladder, causing cholecystitis or infection of the gallbladder or inflammation of the duct system. All this can result in not only pain but jaundice, fever, chills. So all these symptoms can result due to a complication of gallstones. So how do doctors diagnose gallstones? Apart from the history and clinical examination, the most important investigation is an ultrasonogram, which can detect up to 95% of gallstones. And there are other advanced modalities of imaging or scans like MRI or MRCP, which may also be helpful in diagnosing these gallstones. How do you treat them? We have to understand that not all gallstones require treatment. When your gallstones are asymptomatic, essentially there is no need to treat these. When you have a symptomatic episode but subsequently you don't have symptoms, again you can wait. Only when you have recurrent symptoms or persistent symptoms, you need to undergo treatment for these gallstones. The most common form of treatment is removal of this gallbladder called cholecystectomy using either laparoscopy or an open surgery. Very rarely, when the person has some other disease or is not fit for surgery, there might be medicines which can be tried, but this have to be for a longer period. You can also have recurrence of gallstones. So essentially, medical management of gallstones is a second option compared to surgery, which is the first option. But in majority of individuals, you don't need either of these. If you are asymptomatic, you need not worry. How about stones present in the duct, that is in the bile duct, especially if they cause obstruction? Again, you may require surgery. You may sometimes require an endoscopic removal of these stones followed by surgery. So this is regarding the management. How to prevent these gallstones from happening? Essentially, what you need to do is to maintain a healthy weight. Since obesity as well as losing weight fast is a problem, so maintain a healthy weight. If you want to lose weight, have a structured approach where you consistently lose weight. Do not crash diet. Do not skip meals. A diet rich in cholesterol, a diet low in fiber predisposes to gallstones. So switch to a high fiber diet which is lower in fat to prevent these gallstones from happening. If you have the gallstones, does essentially eating a fatty meal precipitate an attack of this colic or biliary colic? Not necessarily. Having a heavy meal, whether it is fatty or not, predisposes to a biliary colic. So if you have gallstones already, try to avoid heavier meals, not necessarily only fatty meals. Friends, this was a short discussion on gallstones. If you find this video useful, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.